Hello, I'm Dr. Michael Marin, the Chairman of the Department of Surgery for the Mount Sinai Health System, and we're here today to talk about robotic surgery and its impact on surgery as a specialty, but also, most importantly, how it's changed the way we approach problems with minimally invasive surgical procedures. Minimally invasive surgery incorporates many different aspects of what we do in the operating room, including cardiac surgery with heart bypasses or coronary artery bypass surgery performed using minimally invasive approaches. It incorporates the repair of aortic aneurysms, all manner of surgeries that are performed on the intra-abdominal space inside your abdomen. And of course, more recently, there's been an evolution in treatments of the spine and spinal surgery using minimally invasive techniques. These techniques are arguably most important because they change the type of incision we perform, but that incision is only one manifestation of what's happening below the cut or below the operation. When we enter the abdomen using a minimally invasive approach, it allows us to distort, damage, and injure less portions of the structures that are inside the abdomen in order to get to the area of disease that we wish to fix. So we might end up with an operation with less of an incision at the top, as you see here in this picture, but also perhaps less dissection and operative damage inside the abdomen at the end. What robotic surgery has done for minimally invasive surgery should be understood in the beginning as not robotic surgery as what most people understand. We are not using robots to perform operative procedures. Robots augment or enhance the capacity of the operating surgeon, but actually do not take over any of the thought process or truly functional processes of operative surgery. What robotic surgery has done is allowed us to take minimally invasive surgery to the next level with enhanced equipment, tools, and devices that can make things easier, allow us to do the same things but do them in an easier fashion. And in some instances, they may even extend the capacity of minimally invasive surgery to do things we could not do using minimally invasive approaches before we had access to robotic devices. We're merely using a series of tools, instruments, changing the equipment that we use to perform procedures that we have always done and have been doing a variety of different ways for many, many years. An example of what's happening with our equipment or our technology includes the fact that we have excellent hands as surgeons. We believe we have gifted hands as surgeons, but they have just so much capacity before their steadiness, their capability in very fine motions may be extinguished by the complexity of an operation. We have very good eyes as surgeons. We can see well. We can functionally determine the things that need to be done and guide our hands in doing the different functions using our eyes as our guide with great deal of efficiency. But they only work so well and they can only see so far. We also have procedures that we do that are particularly out of the reach of our fingers or our hands or our instruments. We can't get to these sites in order to functionally perform the procedures that are necessary in order to allow the operation to be completed. Finally, we only can flex so much. Bending over the operating room table, performing procedures as we do, in the way we do, takes its toll on the operating surgeon over many years. And the question as to whether or not there's something in the technology development side that might improve our ability to functionally be able to perform the operations we do now, next year, and the many years to come. Robotic surgery actually answers many of these questions and provides technological solutions to these challenges. The tremor issues associated with the human hand, particularly after long operative procedures when fatigue sets in, becomes a perfect opportunity for robotic technology to help us. The simple robotic tools that can be developed for a variety of operations have evolved in surgery to incorporate the systems that you'll see in this discussion as we get into it in a deeper level to stabilize the human hand, remove tremor, and allow very small, microscopic almost motions to be performed without any unusual or unnecessary movements. Magnification is a key part of surgery, especially when operating on very small or limited structures. And the robotic equipment that we have at our disposal today allows us not only to enhance magnification so we can see small objects in a larger field so that might be operated on with more experience and more skill, but it also allows us to see using dual camera systems, allows us to see in 3 dimensions, which allows depth perception to occur in a much greater and a facile way than ever before using minimally invasive intracavitary surgical procedures. And what about that issue associated with reach, being able to get your hand into deep spots which may be not accessible with standard operative procedures or other equipment? Well, robotics, because of the way robotic arms and systems work, allows us to access points so we could do procedures that are very fine and delicate inside a narrow space, the diameter of a beer can, and at the bottom of that beer can, so that you can actually do manipulations, sew very fine blood vessels and structures, and do so in these contained spaces. This would not be possible without being able to get imaging, lighting, and instrumentation under great deals of control with great articulation into these sites in order to perform these procedures. This is just one example that you see here of working down in the human pelvis, which is a very narrow space, difficult to access, difficult to see, and difficult to control various instruments, scissors, clamps, and forceps in these sites without the support of a robotic piece of equipment. Finally, surgeons' comfort, which should not be dismissed but is often forgotten in the discussions about how technology should evolve, is certainly present. The ability to sit at a console and to do your operative procedures in a comfortable chair with your arms, legs, and the rest of your body and spine and central core all aligned in a way that is more facile to get comfortable and more easy to sit and work for longer periods of time, all are possible using remote and robotic technology. And of course, when the console is somewhat separate from the operative site, you can imagine that these procedures don't even need to be done exactly in the operating room. So one can conceptualize, as technology improves, the ability to do telemedicine or telesurgery at remote areas, particularly in areas that are underserved around the world, with expertise and skill that would be present in the hands of a talented robotic surgeon. So we've seen a number of things that have happened here. We can steady our hands, we can include and improve our vision, we can enhance our reach to places inside the human body which were not accessible to us before using standard minimally invasive tools. We can get comfortable doing the procedure. In other words, we can preserve the surgeon's body in the whole process. We've applied these technologies to a whole host of different surgical areas, cancer being one of the most important ones, and surgery of the prostate gland in men, colon and rectum, the ovaries. All of these have found applications using advanced robotic surgery. Enabling technologies of all sorts have changed the course of medicine around the world, and robotic surgery is another one of those examples of enabling technology changing and increasing the things that we can make possible. Thank you for joining us today, and I hope that this educational forum proves useful to you in the future.